Hello, everyone, and welcome to the Data Hunt Uninsured in America. I'm Tracy Flood. I'm president and co-founder of the Broad Street Institute. This event is hosted by the Broad Street Institute. We are a registered 501c3 nonprofit, and first and foremost, we are a learning community. It was a community built for interns, by interns, for learners, by learners, and indeed, 100% of the funding for the Broad Street Institute is from our learning community. All right, let's go on a data hunt. Going on a data hunt. Speedrun tour of data resources. Why look at uninsured? We are not going to spend a ton of time on why look at uninsured. There's some great resources out there. We will not do it justice, but we're going to talk about the data ecosystem and where we can find data. That'll be the thing we spend the most time on. Why uninsured? Health insurance. This will not surprise you. Health insurance is an incredibly important upstream social determinant of health with a ton of evidence showing that's associated with downstream health outcomes. Now, the biggest thing is that it has been associated with premature mortality. Populations that have low rates of insurance do not live as long. There's so many preventable things that are not, it's a social determinant of health. It's one of many. So County Health Rankings does a beautiful job of laying out how all of the different social determinants of health flow downstream to length of life and quality of life and clinical care, including access to care through health insurance and or through location of those healthcare resources is so very important. All right, let's look at the data ecosystem specifically for the indicators of uninsured. Now, how do we find those who are uninsured? Health insurance companies have a lot of data, don't they? But uninsured populations are not in those data systems because they do not have insurance. So we rely on asking people through national surveys, do you currently have insurance? And if the answer is no, they get coded as uninsured. This will not surprise you, but there's also other ways for us to collect the data. So for instance, through birth records, if the birth occurs and those who were pregnant were not insured. That's one of the ways we can do it through vital records. The other thing is if people go to the hospital and those hospitals collect discharge data and they have a list of discharges of those who are not insured. So that's another place that we can find this data. So really it is a bit of a data hunt to try to find these data sources, but they do exist. Now, often they exist. They might only exist if we're doing a survey. Maybe the survey is only on a sampling for the state. And so then you need people to do calculations, to do small area estimates, to try to bring those state level estimates down to the county or city level. So you find that in this data ecosystem, there's a lot of people doing extra calculations to turn that survey data into very, very localized data. So it's not just a national estimate. All right, then you've got the curators. The curators are pulling together all of the different data sources or select numbers of data sources. Some of them have very tightly curated indicator lists, and then putting them all together, and you can view them in different ways, and maps and graphs, etc. So the curators do all sorts of things with the data, but the main gist is that they're pulling from different data systems. So we've got the originators of the data, those collecting and calculating the data, as well as those who are curating the data as well. Sometimes the survey creators are the calculators. Sometimes it's different people. This is the data ecosystem. Examples of this national survey include the American Community Survey or the Behavioral Risk Factor Surveillance System. And then you also have calculations and small area estimates programs like the Small Area Health Insurance Estimates that uses data collected from multiple sources and the places data. All right, so BRFSS data becomes places data once it is small area estimated from the state level down to the local level. You don't have to memorize that, but just know if you start to see some indicators that look a little bit similar, that's why. Now, what's an example of a curator? So one of my favorite curators is the CARES Map Room out of the University of Missouri. We'll be looking at them right now. So I definitely agree that local data is harder than state and national data to find. So we've really placed emphasis on local data sources. So where can we go lower than the state level? The state level is just too broad. And when you're sharing data at the state level, often people just attribute it to the biggest city in the state rather than the local region. So yeah, we really love local data. So let's go in. We've got sources of data. We've got related sources of data, not health insurance per se, but things that are related to health access, and then curators of data. So that's when the CARES Map Room will come in handy. County health rankings, congressional health district, they are very precise on which indicators they choose. I have a curated list of indicators relating to health outcomes. CARES Map Room has it all. The CARES Map Room is out of the University of Missouri. All right, sources of data. We are going to freaking fly. Sources of data, data.census.gov. Let's go. This is the main source that we'll be looking at today. So I'm not going to spend too much time here because this is my favorite data source. And here's why. Data get very, very small when you're looking at American Community Survey data by the US Census Bureau. They go to very, very small geographies. You can do neighborhood characteristics here. You can define your neighborhood with census block groups. It's so itsy bitsy. All right, small area estimates program. This one is a more robust, more accurate estimation, as you might say, by the US Census Bureau, but it's only to the county level. They don't go super small on it. It also can be accessible through data.census.gov, and there's also alternative ways to view it, like this dashboard here. You can select your counties from here and then go for it. It's county level data. Whoop. All right, so then the Places Project. This is the behavior risk factor surveillance system that is then calculated to be very small indeed. They go to the city level and in some cases even smaller. So they ask people, are you insured? And depending on how they answer, then you can zoom in and see. So the places data, this gets very granular and you can see it by, gosh, what is that? Census Tract and then the city of Milwaukee too. So places data does a great job. Now remember, these are small area estimates and just estimates. People have been asked, do they have health insurance? And then based on their characteristics, it's been estimated at a smaller level. All right, healthcare cost utilization project. This is a different style of data. These data are from hospital discharge data. Some states collect all payer, all claims data and submit it to a unified database where HCUP net shows this information. Very few people use this data source, and I wish more people used it because honestly, it is one of the best sources of data, like real data. And when I say real data, I mean, it's not a survey where they've just been estimating it. It's essentially the discharge data. So one discharge is one data point, essentially. It's not one survey equals multiple people. So you can do a 3-year time span. Now, the hard thing with this one is that it's a little bit clunky to use, but once you get the swing of it, then you can really look up a ton of different things. So you can look up coronary atherosclerosis, for instance, or things that are related to heart attacks. And then here's the keys that you want to look at it in detail by payer. And you can see how many uninsured discharges there were, the average length of stay, the cost of stay. If you're trying to make the case for resources used and uninsured, uncovered hospital stays, then this is a really excellent source of data. Not all states have this. It is up to the states whether or not they report it. Hopefully your state has it. Next data source. Birth records, CDC Wonder. Another source of data that is not survey data are our vital records here in the United States. You can go into the birth records. This is an extensive, incredible data source. If you have not used CDC Wonder to look up different data sources and different things, then please do. All right, so this is all of the births in the US. It doesn't show all places. If the numbers get a little bit small, it doesn't show all places or report the data, but you can look at the source of payment for the delivery. Obviously, this is a very thin slice of the population. It is those who are giving birth, but you can see where self-pay becomes a challenge. Now, a lot of states do cover births, and so this might show you where some extra coverage might be needed. All right, and then you query it. We're not going to go into detail there, but it is a cool resource. All right, the Uniform Data System. This data source is lesser known because it's only data from health centers that are funded by HRSA. So for instance, federally qualified health centers, they have what's called a unified data set, and they share a lot of data through those data sets. Now it is a data download, and I actually recommend if you're looking at this data to look at it through CARES, which we're going to be going over in a second. Related sources of data include the shortage areas, health professional shortage areas. Now this is not uninsured per se, but this does show where access to care might be an issue. And you've got different ways to explore health professional shortage areas for primary care, for mental health, and dental care as well. All right, let's look at the curated data. By far, one of the best, most extensive curations of data is the CARES Map Room by the University of Missouri. Very few people use this. Why do so few people use it? It has an incredible amount of data in it. And honestly, most data hunts should start here. So if I just look up insurance, then I can group the results by the source of the data, see all the different data sources that there are, look at all the different data sources that they have. This is where the facility data are. You can also look up small area health insurance estimates. Remember, these are data curators by poverty status, by gender, by age. Look at the uninsured. And then you just go boop, boop, onto the map, view the legend. And there it is. You can adjust the opacity. You can adjust the granularity. It is so unbelievably cool. Why aren't more people using this? It is so awesome. Please go to the CARES Map Room and explore their vastness of their data. It is kick-ass. All right, a very different vibe are county health rankings that look at a very curated list, an indicator list of data sources that are relating to health down the line. So County Health Rankings has a ton of data. You can download their data sets. It's a huge data set. It's an awesome Excel spreadsheet that you can do. And you can look up data. This is not usually the way people do it. Usually they go by the county health rankings themselves. So let's go Milwaukee, Wisconsin, and you can start to see the numbers. They have changed over time. Tables, maps, graphs, methods. This is the coolest part about them, is that they share all of their methods. Awesome. And I'm going to loop back actually, because the CARES Map Room also shares their methods. Boom, boom, boom. And over here, you can see if you just look at this little eye. All right, sorry, can't quite not tell you about the CARES Map Room. So let's go back. Uninsured. Okay, so if you're making the case for health in your region, then I do recommend County Health Rankings or Congressional Health District Dashboard. Now, this is for DC districts. So you can look up their metrics. You can look up all of the different metrics that they have. Again, a curated list, and they give really great justifications for why they include the data that they do. So here it is by congressional district, and you can see more about this metric, why they chose it. I love these tightly curated lists. They really provide an excellent background of why I look at this indicator in the first place. What are the limitations of this indicator? Strengths of the metric, the limitations of the metrics, strength of the metric, the limitation of the metric, how they calculated it. They're really, truly great sources of curated data relating to downstream health effects. If I have not named something, then feel free to add it here. Boom.